Guest is a natural medicine practitioner, popularly known as alternative medicine. He is the CEO of Calm Natural Cures, Block 14, Godija, Ibadan. Join me as I welcome Dr. Olajide Michael. You're welcome, sir.
Thank you, my sister.
Yes, sir.
And good day, my listeners at home.
Sir, today we're talking about Nigeria's health system. And it is being said that we have the best doctors in Nigeria. And from research, we know that a very good percentage of doctors abroad are Nigerians. But why are we still lacking behind in the health sector? We are still having problems in Nigeria's health system. So what do you think is the problem with Nigeria's health system?
Well, I would like to say this as a naturopathic practitioner. I think we just need more of funding and collaborations. There was a time we had a meeting 2012 at UI on a therapeutic effect of natural medicine. We were now looking at integration or segregation. But at the end of the day, we come to understand that we just need to collaborate. We need to integrate. We don't need to segregate. But government needs to do a lot of fundings to help our people, because most people want normal or just cheap health care, but there is no means. They don't have the money, they don't have what it takes for them to get their health in shape. So it's one of the major factors that is disturbing the public.
Talking about funding, now we have the primary health care, which is at least a bit affordable for those of low income. We have the health centers and the clinics around. Now, looking at it this way, do you think these primary health cares are adequate? What are the things that should be put in place? Because there are some health cares that you go to, health centers that you go to, and in fact their infrastructure and the things they have, they are not even adequate enough to treat a patient. So what do you think can be put in place to make sure these cases are adequate?
Well, from infrastructure to the competent hands to the nurses, the doctors that should be available, government should try to do all they could to put proper infrastructure in place, because you see a lot of dilapidated buildings all around where you cannot even relate to as a hospital, let alone where people will be delivering and the likes. So they should try all their possible best to make sure they help this system. See, one of the problems that I see in this nation is that individuals want to do something instead of putting system in place to run something. In advanced country, each time we travel, nobody is there to watch you or to do this or that. Sometimes they have a proper system in place, and once you are following, you key yourself into the line of the system, you see everything running the way it ought to run. Okay, come to think of it, you don't know, we have different bad heads among the practitioners as well, and you have many that are good, but you don't know who is who. But your own is put a good system in place that can checkmate everybody. Once you put that, you see that everything will run the way it ought to run.
Now, there are some hospitals that actually have a good system. They have all the infrastructures and all, but then if you go to places like that, we don't get adequate care.
Then competence come in, my sister. Now, headache is not a disease. It's just a signal. It's a pointer. It's just it's an alarm that is telling that something is wrong somewhere. In advanced country, if you get to a good doctor, if you complain of headache, he will not just, if you complain of headache and the doctor just prescribe this, that, and the other for you, he doesn't want to send you out. But the best thing is for him or her to tell you, oh, go and do this diagnosis, do this test, do this. By the time you do some series of tests, and which is another issue with our people also, most people don't want to go for the proper checkup. And doctor is not God, so he can't see only the report of maybe the blood test, the urine test, and the likes, that he can now tell you, oh, based on this and this, then you need this. You understand? So it lies on our people also to cooperate, to make sure they do the needful by working hand in hand with doctors. When the diagnosis is required, they should give a proper support.
Okay, sir. Now talking about secondary health cares, now there are cases of inadequacy as well as overcrowdedness. For instance, if you need a care now, if you need a care, going to places like let me say Adeoyo for instance. Now there was a case some months back where a patient was taken to the hospital, but at that moment they complained that there was no light to treat the patient. Now sir, what can you say about it? There are cases of inadequacy even in secondary health care units.
Well, you can't rule anything out. I would like to be sincere with you, but you know, it still comes back to the funding. If it's not adequate, if they are not adequately funded, then you should expect that, because doctor will not use his own money to go and fuel the gen. So it comes back to the system. If you have proper system in place, there should be somebody that should be in charge of that, that maintains the generator, service the generator, put the fuel there at the appropriate time. Then doctor has no option, he will carry out his own duty. And the nurses, they will do whatever they're supposed to do. The honor is on government to try as much as possible to assist in this line, in order for us to have better practice and to deliver better services to our people.
Thank you very much, sir. Now, how can individuals how can individuals invest in setting up secondary healthcare in Nigeria?
Well, it's quite expensive to do that, but it's possible. It requires willingness. It takes a mind that is willing to go in that direction, for it to have like minds that can come together to form a team that can do that very one. But I will not be a deceiver. I would like to be sincere with you that it's very expensive. It's rare for you to have that, but it's still possible. If God bless me, if God blesses other people, they can team up together and see what they can do about that, because at the end of the day, it will generate enough revenues, and it will help the government, it will help our citizenry, it will help everybody at the end of the day, and will lead a normal and better life.
Thank you very much, sir. Now, talking about health insurance, what ways do you think we can help in funding healthcare providers?
Well, my sister, as regards the health insurance, I think I'm of the opinion that it's a high time for them to make it general. They shouldn't limit it to working class alone. We should try as much as possible to generalize it, permit as many people that want to participate in that scheme, so that, because it's garbage in, garbage out. It's just like normal insurance you are doing. If 1 million people insure the car, like myself, I do comprehensive insurance sometimes. So if you do it, many people will not go for claim. Many people will not have a claim till the end of the year, and that money will be able to supplement for so many things. So I think it's high time for the NHIS, the insurance, whatever, to come together and brainstorm better on what they need to do.
That we'll be going on a short break now. We still have Dr. Olajide Michael on the show today, and this is State Affairs. Welcome back to the show. We still have Dr. Olajide on the show today. Okay, so I will be asking questions on natural medicine, which is your area of specialization, sir. What did our forefathers live on?
Well, thank you, my precious sister. Our forefathers have been living on herbs, fruits, and roots, vegetables. I come to understand that a lot of things that is bedeviling us is as a result of the lifestyle we copied. And we were working on a research, and we stumbled on another research from UN of recent. I think it was done May this year, to 2019. We discovered that one of the major terrible things that is likely to affect most of humanity is called oxidative stress. And other things that has to do with the climate. Now, when I'm talking about the climate, I'm talking of the atmosphere that we find ourselves, that we have really find ourselves in a mess, total mess and complete mess. What am I saying? I discovered that most people that are not living normal life again is as a result of 9, or let me say 8 out of 10 disease condition is finally traced back to this oxidative stress. You know, like in Chinese traditional medicine, part of where I was groomed from, I discovered that they do teach us something. They call it yin and yang. It's like positive and negative. It's like when you are talking about pH level, it's like you are talking of alkaline and acidity. Now, they understand the way human system works. I'm talking about forefathers now. They've lived on so many plants like what we call Oteria oblata, Senna alata, Cholecytis citrullus. What are these things? They are cheap things. Like Oteria oblata is abere in Yoruba language. And you need to Google Oteria oblata and see numerous things that thing works on. And I, as a natural medicine practitioner, I may bold to tell you that I've seen the action of this thing all over the world. And that's why we are very happy to make so many products around that is going globally, because we know what we are talking about. It's high time for us to patronize homemade. It's high time for us to know what we need to know. I'm talking of a research where we have a bunch of professionals, where we have a doctor in the team, we have pharmacists, we have pharmacognosy toxicologists, we have cellular biologists, we have biochemists, we have nutritionists, combining their brains together to formulate our own product with our natural ingredients. And I tell you, it's another thing altogether. Now, part of what I've discovered that we are looking down on, that is our home product. Okay, there was a time I was presenting on what we call transfer factor. If you see this, they are all natural source. This transfer factor is like we are transferring immune memory code from a donor to a naive recipient. A thing that will work on B cell, T cell, lymphocyte, and NK cell. Something that has better promise of even improving the NK cell by 37% in 48 hours. There is no supplement, no drug, no nothing can do that in the history of work. Not even lymphokine interleukin 2, which is orthodox drug,
now
can go that far.
Sorry to cut it. Now, these things you are mentioning now, do they have their own side effects on the patient?
Well, everything has a side effect, but you know there are good side effects and there are bad side effects. Like part of what I've been talking about, when they are properly worked on, the side effect is a good side effect. You can't call that side effect. Okay, part of side effect of one of the products is that it will make it revamp the system of a man completely, to the extent that you can now perform to the optimal level. Is that a bad side effect? If you consume overdose and you are very big, it can give you, you can visit toilet more frequently than the way you usually go. Then again, there are some of them that will induce your sleep better at night. That you will, if you have been sleeping for 6 hours, you may have your 8 hours. These are side effects.
Now, talking about natural remedies. Now, majorly these our old parents and all, they prefer to take natural, what they call what's it called? Agbo. That is what most of these people like to take. Now, my mom, for example, now if she has probably any pain or any illness, she would search online and look for natural medicines or remedies for that particular illness. Now, my question is, are there dangers involved in prescription natural medicine use for the user?
Well, if non-professionals are handling it, there could be. In my seminar, I taught people something sometimes ago, where somebody was trying to grind a bottle and had it to some plants, some roots she grinded for ED, that is erectile dysfunction. Then one of my trainees that came to me so many years ago asked me that, sir, I saw this in so place today. I said, well, that's where they get it wrong. I said, what has bottle got to do with erectile dysfunction? I said, it has no component in it. It has nothing to do. I said, see, you just need to know. Let me go back to your question properly. See, you need to use a well-researched product that is natural than the one that you cannot really talk about, or you don't know the theology of it. You must be careful. It's better you play safe. Because the major thing is you are looking at your organs, the kidney and the liver. You need to be sure of. But come to think of it, these are the things that our forefathers live on, and they have better life. They live longer than we do.
Okay, sir, can you share a story or a testimony on breast cancer that you treated in the past?
Oh, well, by the grace of God, I have not only on cancer of the breast, I have cervical cancer, I have prostate, that is PSA, prostatic specific antigens, that has gone over, because that one treats me more. I told you that has gone to more than close to 100, that is PSA, and in no time it reversed back to 1.7. They were shocked. I have another one in Ibadan here, that PSA went to over 3,000, and to the glory of God it comes to 57 in less than 2 months. But that's not it. For breast cancer, I have numerous ones. In fact, that's what brought me into this. My own wife, we had the issue with her breast. That was 16 years ago. And to the glory of God, after then, she gave birth to one girl. That girl is just entering university now, UL. And she solved that same breast. After that, 8 years ago, we had another baby.
Wow.
That's my last bus stop anyway. So, and to the glory of God, they are all doing fine. With the same breast. It's all about what you know. If you don't know, don't assume and don't say never can it be. Because where the problem lies, if you are criticizing alternative medicine, you may need me as a matter between life and death. Then where do you run to? Thank you so much.
Thank you. That will be all for today on the show. We have heard a lot about on alternative medicine,